In this section, we will talk about substance use disorder treatment best practices and the employer's role in prevention and treatment. Addiction is a treatable disorder. Not one thing works for all individuals. Therefore, a multifaceted approach to care is required as individuals with substance use disorder rebuild healthier lives. Treatment of the whole individual should be the cornerstone of care delivery, and care delivery should be based on a chronic, ongoing, not acute, short-term model of care. It's important to treat addiction as the chronic disease that it is, through accessible, clinically proven approaches to treatment and continuing care and recovery support. Treatment options will vary by individual and can include medically managed withdrawal management, treatment to address co-occurring disorders and other health problems, varied level and length of time, treatment for specific groups such as by age, gender, or professions. The National Institution on Drug Abuse lists 13 fundamental principles for the provision of effective substance use disorder (SUD) treatment that is based on research. They are not opinions, but empirical and fact-based conclusions. The 13 fundamental principles include addiction is a complex but treatable disease that affects brain function and behavior. No single treatment is appropriate for everyone. Treatment needs to be readily available. Effective treatment attends to multiple needs of the individual, not just his or her substance use. Remaining in treatment for an adequate period of time is critical. Behavioral therapies, including individual, family, or group counseling, are the most commonly used forms of substance use treatment. Medications are an important element of treatment for many patients, especially when combined with counseling and other behavioral therapies. An individual's treatment and services plan must be assessed continually and modified as necessary to ensure that it meets his or her changing needs. Many individuals with SUD also have other mental disorders. Medically assisted detoxification is only the first stage of addiction treatment and by itself does little to change long-term drug use. Treatment does not need to be voluntary to be effective. Drug use during treatment must be monitored continuously as lapses during treatment do occur. And treatment programs should test patients for the presence of HIV and/or AIDS, hepatitis B and C, tuberculosis, and other infectious diseases, as well as provide targeted risk reduction counseling linking patients to treatment if necessary. A full continuum of treatments requires a seamless transition to the level of care needed throughout treatment. This can include early intervention, outpatient services, intensive outpatient or partial hospitalization, residential or inpatient services, and medically managed intensive inpatient services. The 2019 Indiana Workplace Substance Use and Recovery Survey, conducted by Indiana Workforce Recovery, measured Indiana organizations around 5 drug-free workplace program best practices. While many organizations, 65%, have a written drug and/or alcohol misuse policy and 64% conduct drug testing, less than half, 45%, have a plan for directing employees to assistance with drug and/or alcohol problems. Only 20% of organizations have annual employee training, and only 15% provide annual supervisor training. Let's look more closely at the employer's role in prevention and treatment. If your company provides health insurance and benefits to employees, amending the coverage you provide and taking the following steps can help improve addiction treatment outcomes and address the opioid public health crisis. Offering health benefits that provide comprehensive coverage for substance use disorders, including aftercare and counseling, Understand out-of-pocket expenses associated with assessing care via your benefit plan, educating employees to the health and wellness risks of opioid and substance misuse through company wellness programs. Employee Assistance Program, or EAPs, can support employees who may currently be experiencing a substance use disorder or who may have a family member affected, linking employees to services and support. Additionally, Pharmacy Benefits Program can support alternative pain management solutions and programs to manage prescription opioid use. Implementing a drug-free workplace and other substance use policies and educating employees annually. Respecting the employee's privacy and creating a stigma-free workplace. Finally, we'd like to share with you that research indicates that employer-supported and monitored treatment yields better sustained recovery rates than treatment initiated at the request of friends and family members. In this section, we will talk about recovery from substance use disorder, or SUD, including employer tips for supporting an individual in recovery. According to Substance Abuse and Mental Health Services Association, or SAMHSA, recovery is defined as a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. Recovery does not mean that treatment has ended. As we learned in the prior section, SUD must be treated as a chronic disease. Treatment needs to be individualized. It needs to treat the whole person. It must address co-occurring disorders and other health issues and be continuous. Hence, behavioral therapies, medications, integrated co-occurring disorder treatment will continue throughout recovery based upon the needs of the individual. The trans-theoretical stages of change model is used across disciplines and is helpful in breaking down the complex process of changing behavior into 5 distinct stages. The first stage is pre-contemplation, not thinking about change. Second is contemplation, considering change. Third is preparation, making decisions for change. Fourth is action, commitment, and beginning to change. And the 5th stage is maintenance. Change has become integrated with life. It is common for an individual to go through the process 3 or 4 times before they make it through the cycle of change without a slip or setback. Setbacks, while not ideal, provide the opportunity to learn. Recovery is associated with dramatic improvements in all areas of life: healthier and/or better financial and family life, higher civic engagement, dramatic decreases in public health and safety risks, and significant increases in employment and work. The employer is a critical component of recovery. Employment is at the core of finding purpose, one of the 4 dimensions of recovery. The 4 dimensions of recovery include health, overcoming or managing one's diseases or symptoms and making informed, healthy choices that support physical and emotional well-being. Home, having a stable and safe place to live. Community, having relationships and social networks that provide support, friendship, love, and hope. And purpose, conducting meaningful daily activities and having the independence, income, and resources to participate in society. Some U.S. states are creating recovery-friendly workplace initiatives. These workplaces are willing to overlook employment gaps and some brushes with the law that accompany drug use. They encourage open discussion of addiction in the workplace to reduce stigma. Perhaps most significantly, they treat substance use and relapse as medical issues like surgery or maternity, a time for the company to support, not abandon the employee. Having a job or career where the employee feels supported and recognized with the opportunity for growth is positive for both the employer and the employee. Some tips for supporting employees in recovery. Provide an open, stigma-free work environment. Educate management and/or supervisors to substance use disorders, or SUD, and the needs of people in recovery. If an employee shares that they are in recovery, ask the employee what you should be aware of, how the company can best support their recovery. Allow for flexible working hours and/or schedule to support the employee's recovery commitments. Be aware of early signs of potential relapse and address early with your employee. Encourage use of Company Employee Assistance Program, or EAP. Provide information about the Equal Opportunity Employer, or EOE, and the Reasonable Accommodations Policy of the American Disability Act, or ADA, and safeguard the confidentiality of employee health information. In this section, we will talk about return to use, a relapse or setback which is common with chronic illnesses. A setback or relapse means a deterioration in someone's state of health after an improvement. Setback rates, or how often symptoms recur for people with addiction, are similar to rates for other well-understood chronic medical illnesses such as hypertension and asthma. Does a setback mean a return to use? Not necessarily. It can mean a setback in health, thoughts, activities. Does a setback mean that the treatment has failed? No. The chronic nature of the disease means that lapsing back to substance use is not only possible but expected. When this occurs, treatment needs to be reinstated or adjusted, or other treatment should be explored. Relapse is a gradual process with distinct stages. What follows is a representation of a basic relapse. As we discussed in prior modules, due to the complexities of the brain, co-occurring disorders, and trauma, the stages of relapse can differ greatly. The first stage is emotional relapse. In emotional relapse, you're not thinking about using, but your emotions and behaviors are setting you up for a possible relapse in the future. The signs of emotional relapse are restless, irritable, and discontented, plus poor self-care. Second stage is mental relapse. In mental relapse, there's a war going on in your mind. Part of you wants to use, but part of you doesn't. In the early phase of mental relapse, you're just idly thinking about using. But in the later phase, you're definitely thinking about using. And the third stage is physical relapse. Individual starts using again. The goal of treatment is to help individuals recognize the early warning signs of relapse and to develop coping skills to prevent relapse early in the process, when the chances of success are greatest. This includes both internal experiences, example, positive thoughts related to substance use, or negative thoughts related to sobriety that arise without effort, called automatic thoughts, and external cues, examples, people or places that the person associates with substance use. In addition to identifying, treating, and working on co-occurring disorders, behavioral and medical health, relapse prevention includes building awareness around the potential negative consequences of high-risk situations and thoughts, working to develop and expand coping skills that address specific high-risk situations for relapse, often called triggers. For example, how to confidently and comfortably say no to a drink if it is offered. This is called assertive drink and drug refusal. To urge surfing, a technique to help individuals cope with the intense longings to consume the substance that occurs during cravings. Planning for emergencies, that is, unexpected situations where an individual finds themselves suddenly struggling to abstain from drinking or using other drugs. Strengthening confidence in one's ability to abstain from substance use, even in the face of challenging situations. Building one's self-efficacy, and finding alternative ways of thinking about positive thoughts related to substance use and negative thoughts related to abstinence, sometimes called cognitive restructuring. This activity includes discussing the thinking traps or unhelpful thinking styles that can develop after years of drinking and using other drugs. For the employer perspective and solutions for your workplace around relapse, refer to Module 6 of The Right Dose. In closing, employers directly benefit by helping workers get treatment and enter long-term recovery. When individuals with substance use disorders receive treatment and recover, absenteeism decreases by 36%, and work turnover decreases by 13% compared to a person with an active substance use disorder. For additional information, reference The Right Dose and the Indiana Workforce Recovery Employer Guidelines.